So Penny, I just wanted to take a moment and kind of go over your symptoms and kind of what your story's been, because I've been seeing you for about 18 months. Is that fair?
Yes.
Okay. So what were you diagnosed with?
Trigeminal neuralgia.
Okay. And you sought us out. You come to us from where?
From British Columbia.
Okay.
Yeah.
And so just kind of tell me what made you seek us out.
Well, I got diagnosed with trigeminal neuralgia and went on the medications that they recommended, and I still had like debilitating pain in my face. And we tried like other things locally, like acupuncture or whatever, and without any results. And I was basically housebound and bedridden. There'd be like 4 months at a time I couldn't leave the house.
Sure.
So actually, my husband was the one that decided to do some research on the internet, and he found your website and convinced me to come and see you. So, yeah.
Okay. So that's been a minute. And tell me, like, are you still taking the gabapentin?
No, I was on the highest dose that they could give me, 3,600 milligrams, and I have since been able to get off of it. And so it took 1.5 years to get off of it, but I haven't taken it now for about 5 months.
Good for you.
Yeah. Yeah.
Good for you. So is it fair to say that you feel good enough after the therapy, even though you have been diagnosed with the diagnosis of the suicide disease, that you're able to manage and get by without surgery, without medication?
Absolutely.
Okay.
Yeah.
All right. What have you noticed?
Well, vast improvement in just general life health. It was terrible when she was at her worst. To see her suffer that much, tremendously. It was really tough, and tough on both of us,
Yeah.
But terrible. And so it's been much improved, 90% improved probably, at this point.
Sure. Well, it's interesting because there's a number of dentists and medical doctors that say, well, there's no way
I know
the bites could affect people like what you're describing, right?
Yeah.
This housebound incapacitatedness. No, there's nothing with the bite. And then the people that diagnose the trigeminal neuralgia say, oh, well, she got better with a bite adjustment. Well, she didn't have trigeminal neuralgia. And that's the point, right? So, the watching you come back and forth of a period of time, because I don't see you every other month or every month like I normally do with people that are locals, but sometimes we have to make some concessions, right? If people that are traveling. But you have a slight burning in the face now around a muscle and a tiny twitch around this one area that's kind of been your ground zero.
Yes.
Fair?
Yes, that is correct.
Okay. But you're not getting the intensity, duration, or frequency that you were getting before.
No, I might have a flare-up that'll last for 2 to 3 days, and then it'll go away. And this flare-up has been like a couple of weeks. Yeah, the burning in my face and a little bit of twitching. But my quality of life has improved tremendously. Like, I'm out walking again and getting involved in life. And I mean, it's life-changing for me. Yeah. Even the flare-ups are manageable at this point. Where initially for like the first year, a flare-up, was more intense pain than the flare-ups that I'm having now. For sure. Yeah.
And I suspect you're going to hit another plateau.
Yeah.
Even though, you said, well, I've been really, really good and I'm off my medication and I'm starting to build intensity. Well, your bite needs to be corrected. So you hit like another level of healing.
Yes.
And the body's not going to stop healing just because you feel better, right?
Yes.
So if that bite, if the offending agent, which was teeth on the right side, which is where I primarily do my adjusting, if the teeth move, shift, the joint, heals, or the muscles relax to a point where more healing is allowed, you might have to have a touch.
Yeah.
So, and that's not the end of the world.
Oh, no, not at all. I mean, I'm just so grateful.
I would highly encourage anyone that is in a similar situation with trigeminal neuralgia to look at this very, very seriously and do a bit of research and get going with the procedure, because I'm a firm believer in this whole procedure of what you're doing here. And I think we need to get it out to the rest of the world, because I know there's many, many people that are suffering with this condition and are not tying it to teeth problems, type of thing, teeth alignment problems.
Well, quick question. When you guys started weaning yourself, I imagine the neurologist back home started to cutting back the gabapentin. What did he or she say when you said, hey, this is what I want to do?
Well, my neurologist that I had initially retired. And so my GP took over and didn't refer me off, because he just followed the program of my neurologist. And I just went in and said to my doctor that I was going to the States for treatment for pain in my face. And he just basically didn't want to really hear about it. And so I just took myself off gradually over a year and a half.
Okay.
Yeah.
All right.
It's a very slow process. So
for me,
that's
yeah.
bad.
Yeah.
Well, it's good in the sense that if the body's anticipating the drug being there and all of a sudden you just cold turkey, you're going to have a massive error. Like I've witnessed that.
Yeah.
Which is the whole reason why I said make sure you take her off in half doses and get in a period of time. But it's not shocking to me that your encounter with, oh, my GP didn't really want to hear anything about it. I think most patients would have,
something similar
or be very dismissive. But when you're living it, I think it's a totally different experience that if, one crazy lady with face pain comes in and says, I'm not taking this medication anymore. I don't think any of us really want to be on that stuff. Even when a patient comes in and says, yeah, it helps me and it works, there's always a, but I'm a zombie when I take it.
I was,
right?
I was a zombie.
Yeah.
For sure. But no, so I mean, I was offered another medication to take instead of gabapentin, but I just decided to go off of it and see how my body reacted. And like I say, I'm doing fine now. Yeah.
Good.
Yeah.
Well, I appreciate you letting me share your story. And I think it's unique because it affects both of you.
Yes.
And it affects you, but you're like, where's the lady I married? And I don't want to see her hurting.
Well, it was so difficult to watch her in so much pain and, just crying out in pain and just totally debilitated almost, it's really tough. So I'm really glad we were able to find you or someone that can do the techniques that you use for this, because it's pretty amazing.
My life back for sure.
Praise God.
Yeah.
I'm so glad.
Thank you. Thank you.